Medicaid work requirements, navigating red tape bureaucratic hurdles. Prepare yourself for a dramatic shift in how millions of Americans access vital health coverage. Sweeping work requirements and new layers of paperwork are about to transform Medicaid for many low-income adults across the country. The recently enacted Republican tax and spending law introduces, for the first time in most states, strict rules that will force adult Medicaid recipients to prove they're working, studying, or volunteering, setting off a wave of anxiety and confusion that's only just beginning. But here's where things get especially heated. Critics argue these changes could rip health insurance away from thousands who desperately need it, simply because they get lost in a sea of bureaucracy and technical glitches. Let's break it down. Until now, very few states had ever made Medicaid eligibility depend on work requirements. In fact, Georgia stands alone today as the only state actively enforcing such rules, requiring Medicaid recipients to log in and report their work or volunteer hours every single month. Tanisha Corporal, a social worker based in Atlanta, thought she understood the system inside and out. With 2 decades of experience helping others navigate Georgia's social safety nets, she figured meeting the work requirements would be a breeze when she left her nonprofit job to start her own wellness initiative. But soon, she faced overwhelming obstacles just trying to prove she was eligible. She describes it as a maze of forms, constant rejections, and a system that was anything but user-friendly, even for someone with her background. These new federal work requirements, set to take effect nationwide in 2027, will force most adults under 65 on Medicaid to show they participate in work, education, or volunteer activities for at least 80 hours a month. Alternatively, they'll need to submit documentation for an exemption, like being a full-time caregiver. And the catch? States will have to set up verification systems resembling Georgia's, which have already proven expensive. Over $91 million in state and federal dollars spent in just 2 years, with half the money used to build and run the complicated eligibility reporting tool. Shockingly, fewer than 7,500 people are currently covered by Georgia's program. For Tanisha Corporal, skipping health coverage was out of the question. With prediabetes and a family history of breast cancer, it was critical for her to maintain regular checkups. On paper, she easily met the requirements for Georgia Pathways to Coverage, which provides Medicaid to adults below the federal poverty line if they can prove at least 80 hours a month of work, schooling, training, or volunteering. She gathered all required records, documenting her extensive community service and nonprofit efforts, and submitted them through the state's online portal. The response? She was denied. Repeatedly. Despite her expertise, Corporal spent 8 grueling months uploading documents, appealing denials, and trying to understand why her paperwork was rejected or mysteriously disappeared. Even reaching someone in the state office who could explain the issue proved nearly impossible. Emails from the agency often cited missing or incorrect documents or alleged missed appointments that seemed never to have been scheduled. Her ordeal finally ended only after she publicly testified about her struggles at a hearing that drew the attention of local media. The state, meanwhile, promises improved technology and user guides are coming. But for now, Corporal recertifies her volunteer hours every month using the same glitchy system. The stress continues. Even after all the hurdles to get approved, she says, keeping my coverage is a new source of anxiety. And this is the part most people miss. If someone as experienced as Corporal barely survived the process, how will others, without her professional background, navigate these hurdles? She argues the system is simply too complicated for most people in need. Do you agree that access to essential health care should be this dependent on technological savvy and relentless paperwork? Georgia's work requirement system needed federal approval even before the new national law. The state is now asking for permission to keep its program going after September 2025 and claims it plans to eventually require annual, not monthly, re-verification. But for now, monthly reporting remains the reality and an enormous headache for recipients. Health advocates worry that Georgia's frustrating experience will soon play out across the country under the new law. Laura Colbert, who leads an advocacy group for health access in Georgia, points out that many eligible people never even get enrolled due to administrative hurdles, and some who manage to enroll later lose coverage to paperwork errors and technical problems. And here's where the controversy lights up. While supporters of the national work mandate argue it will save taxpayer money and deter waste by targeting benefits to those truly in need, research suggests the vast majority of Medicaid recipients aged 19 to 64 are already working. According to experts like Joan Alker from Georgetown University, these new rules don't actually increase employment. Instead, their main outcome is to drop people from health insurance. Those who aren't working tend to be students, disabled, or too sick to work in the first place. For low-income families, even basic requirements like stable internet or transportation to government offices can be prohibitive. As another Georgia Medicaid recipient, Paul Michael reported, technical issues with the state's website repeatedly prevented him from certifying his work hours, resulting in lapsed coverage over something as trivial as a typo. So here's the big question. Are these bureaucratic hoops a necessary means to protect Medicaid for the most vulnerable, or are they simply roadblocks that unfairly strip health coverage from those who need it most? Should society prioritize reducing fraud even if it means some people lose access due to paperwork issues? Or is healthcare a right that shouldn't be tangled up in red tape? We want to know where you stand. Should work requirements be part of Medicaid? Have you or someone you know been caught up in similar bureaucratic traps? Share your thoughts below. Do you support these changes, or do you worry they'll do more harm than good? The truth about the one big, beautiful bill, how it strengthens Medicaid. Brace yourselves. The one big, beautiful bill isn't a threat to Medicaid. It's its strongest protector yet. But here's where it gets controversial. Some critics insist this law will strip essential health coverage from our most vulnerable neighbors. And this is the part most people miss. It actually modernizes the program, cuts waste, and even adds billions to support rural hospitals. Earlier this year, President Trump challenged Congress to craft legislation that would advance his domestic policy goals and turbocharge the American economy. The result was the One Big Beautiful Bill signed into law on July 4, 2025. It delivered tax relief for Kentucky families, bolstered border security, invested in military readiness, unlocked American energy potential, and, contrary to the naysayers, strengthened Medicaid for those who need it most. As chairman of the House Committee on Energy and Commerce, I was charged with identifying $880 billion in savings within our jurisdiction. By zeroing in on outdated Green New Deal regulations, promoting American energy independence, and tackling waste, fraud, and abuse in Medicaid, we surpassed that goal, locking in over $1 trillion in savings. In recent weeks, some on the other side of the aisle have spread.